All right, good afternoon, everybody. Welcome to this afternoon's quick webinar on restrictions for an orange zone. My name is Kathy Purdy. I'm a marketing manager here at Schoeneck King. Just two quick housekeeping items before we get started. Please enter your questions through the Q&A box located at the bottom of the screen, and we'll do our best to get through those as time allows. And if you would take a quick moment to complete the brief survey once the webinar has ended, we would greatly appreciate that. So to kick off today's program and hand it over to Katie Anderson.
All right. Thank you, Kathy. Yeah, we have thank you for all of those who joined us for the 12 o'clock webinar. Now you get even more of me. We're going to be discussing what the latest restrictions are in cluster zones. So one thing that's worth noting, I was taking a look today at some of the things the governor was saying. I didn't say this on the earlier webinar today, but it's of interest, I think. Currently, state projections with holiday activities, the infection rate across the New York State, currently it's 2.93% positivity rate, excuse me. They are projecting that by January 2nd, we will be at 12.46%. If the rate continues to rise at the rate that it is rising, and then you add the additional socializations that will come from the holiday season. One, important thing here too is that this will mean that there's going to be more and more restrictions coming into play. First thing to examine here is we have 26 different cluster zones. That is a big change from last week when we had, I don't remember, not 26. We had a lot fewer than that. So what does it mean if you're stuck in an orange zone? That is something that's, we really want to focus on, since especially Monroe County, so Rochester and Syracuse are now in orange zones. Orange zones. All non-essential gatherings have to be limited to 10 people. In a yellow zone, they can be 25 people, but all non-essential gatherings are limited to 10 people. Remember, the definition of a non-essential gathering under the executive orders, you have Executive Order 202.14. It's really the one that defines non-essential gatherings. It includes meetings. It includes just a party. But there's very few gatherings that are considered essential. So keep your eyes out for that. Really, you got to be strict about those gathering limitations. Non-essential businesses, including gyms and personal care services, must reduce their in-person workforce by 100%. I will be going over in a few minutes some more details about how to determine whether or not you're an essential business, especially for red zones. But just know that personal care services and gyms, both of those things are being interpreted pretty broadly at this point by the state, but really it's by your local health department. If you have questions about your business and whether you are considered either a fitness center or a personal care service, give us a call or give a call to your local health department. It's really hard to get in touch with people right now because it's so jammed up. There's so many people calling. Or call, if you have one, and you probably do, your local economic development office. I found them to be very helpful in trying to figure out whether or not you qualify as an essential business. But again, you can always reach out to us and we can get you that answer as well. We have houses of worship have to reduce their capacity. And then remember that restaurants have to close for indoor dining. Outdoor dining can still occur. You have to have only 4 people at a table. So if tomorrow is the most expansive drinking day in the United States. If you are a bar or restaurant in an orange zone, you got to be strict about that. I will not be surprised if there are not state inspectors out and about looking for this. This is going to be a big test tomorrow. So really you got to limit it to 4 people at a table. outside. Schools, Kate's going to cover that. That's not not my forte. So that's what's happening in an orange zone. And also at the end of this, ask your questions. We will, at least I can stick around for as long as I really need to answer questions. So feel free to pop questions into the chat. We will go over them towards the end. Red zones. So red zones, this is where you have to start thinking we're in March again in some ways, but with a little more clarity than we had in March. Non-essential gatherings can occur. All non-essential businesses have to reduce their in-person workforce. We will discuss that in a second. All restaurants and taverns, so that's bars, breweries, wineries, everybody has to close for all eating on the premises. To-go and delivery is still allowed. And Kate will, again, cover schools. But what does this mean for essential businesses? There is a special essential business list that exists for clusters. I will, when I'm done speaking, put in the chat to everybody. You can click on that link, save it in case you are looking likely to be in a red zone in the future. Save this so you can have this for your reference, but it is very similar. It's not the same list that existed for the New York on pause essential business list, but it's very similar. I pulled this directly out of the guidance because this language is very important to take a look at. If you are considered an essential business and you provide a non-essential service, or you have non-essential people supporting that essential service or whatever, only those operations that are necessary to support the essential service are exempt from the workforce reduction restrictions. So that means you have to take a look at your business, your entity, and determine what is actually essential to and necessary to supporting our essential business. That may involve sending some people home to work remotely. If they can work remotely, you should try to do so. That is going to be important to look at. It also means that for non-essential businesses, you can still have essential workers come. What that means is you can't interpret that too broadly. This is very narrow. It means you can have, if you're a museum, for example, you can have security come in. Security is an essential service. You can have cleaning come in if you want. Maintenance, those types of things may continue, but you have to be strict about how you're interpreting that. You don't want to be overbroad with this. It's just not it won't go well for anybody to do so. And that, I believe, it is what I had to say. So we will take your questions at the end. Keep typing them in that chat box and we will get to them. And now we take it over to the other Kate.
We've got the Kate Brigade here today talking to you about orange and red zones. So my name is Kate Reed. I'm a school attorney at Bond. I work exclusively with Bond's public sector school practice. But I know many of you on the phone today are not administrators in schools. You are employers around the state, trying to run businesses around the state. And unfortunately, schools have an important bearing on how you can operate your business, because even if you're not running a school, you likely have employees who have kids in school. You likely operate within a school yourself. And what schools are doing, you may be a parent that has kids in school, so your own operations will be impacted by these rules. So schools, serve a very valuable childcare function in our society, a meal delivery function in our society. They go well beyond just the provision of educational services. So we see schools really have a big impact on how society runs, when they are not operating full capacity. So we just want to review some of the rules regarding orange and red zone considerations, so you're aware of what's on the horizon if you are already in an orange zone, or if you are destined for an orange zone or a red zone. So under the authority of Governor Cuomo's Executive Order 202.68, Schools that are in red zones or orange zones must close in-person instruction for at least 2 weeks. So this is differentiated from yellow zones, which we talked about in a prior webinar, which is in yellow zones, schools may continue to operate as long as they test a minimum of 20% of their in-person students and staff. In red and orange zones, schools are mandated to close for at least 2 weeks, unless they can follow detailed health and safety guidelines as promulgated by the New York State Department of Health, which we'll get into in a moment. Next slide, please. So schools have the option, and when I say schools, I'm talking about public school district systems as well as private schools as well, parochial, charters, etc. Schools may, at their election, return on the 5th day after the closure. But in order to do so, they have to fulfill very detailed requirements under recent Department of Health guidelines. So one of those is that the school must ensure that anyone who is returning on that 5th day following the closure has obtained a negative COVID test after the closure of schools. So in other words, the test has to have been procured and the result rendered after the school closure was initiated. And those of you who are around the state are probably aware, if not for any other reason than anecdotally, that it's becoming increasingly difficult to get COVID tests right now. And the turnaround time for getting results on COVID tests is likewise protracted. So how this will work in application remains to be seen. But the biggest requirement for resuming in-person instruction, if you've been closed and you wish to reopen after the 4th closure day, is that every person who is returning, including students and staff, need to have that negative test. Next slide. So after testing is procured, COVID individuals who are positive must be quarantined in accordance with DOH regulations. Contact tracing must be performed by the school system in consultation with their local Department of Health. And there also must be an attestation form that is completed by the school and submitted via the DOH school portal that basically documents that this testing mandate has been complied with and that every person who is returning to a school building has been tested. Further, upon reopening, the rules essentially revert to what is going on when you are in a yellow zone, which is that intensive system and exposure screening must be continued to be conducted daily, but also 25% of in-person community must continue to be tested on a weekly basis, beginning 7 calendar days after reopening. The reason for this is the assessment of whether schools are a driving force for contamination of COVID in your community. What we're seeing, nationwide is that schools do not seem to be a big driver right now. Bars, restaurants, which Katie's talked about, the other Katie's talked about at length already, tend to be the bigger driving forces for the community spread of COVID. Schools are not a big driving force, so much so that actually the governor even noted during a press conference yesterday that there may be, although we've not seen it yet, but there may be in the coming days and weeks, updated guidance around the operation of schools for our elementary kiddos, which are our most vulnerable, youngest kids, to be able to get those kids in school in-person instruction, even where larger restrictions are in place. And the reason that the governor offered for that is because it doesn't seem that elementary schools seem to be a big driver. So this would be welcome news, I think, for employers, where obviously the need for childcare with remote instruction is most significant with elementary age kids. So in an orange or red zone, even if you elect to return after the 5th closure day by conducting testing of your entire staff, there is an ongoing testing requirement. Your school or your district will have to continue to test on a weekly basis starting 7 days later. Likewise, there's that ongoing obligation to do the DOH attestations, which are the submission of detailed documentation regarding testing, your testing efforts to the DOH portal for schools. Next slide. Okay, so our testing in orange and red zones raises many of the same issues that we've previously discussed in connection with testing in yellow zones, which is voluntary and where the threshold is not as high. But what we're seeing around the state, unfortunately, is that the state's testing capacity is becoming increasingly taxed. I was on the phone with a school district yesterday that was recently informed by their Department of Health that even though all metrics are pointing in the direction of them going to an orange zone, they're not yet an orange zone, but they're going in that direction, the DOH will not be able to assist them with testing. So we're seeing wide variety around the state of who is willing to do the testing. Most districts, in my experience and in my practice, are strongly preferring that their county Department of Health take the lead on testing. The reasons for that are really multifaceted, but the biggest one is that there is special licensure. An entity must be a limited service laboratory in order to conduct COVID-19 testing, which is accompanied by significant auditing, bookkeeping, and laboratory requirements that can be very burdensome on public and private schools to actually implement. So where the DOH is conducting the testing, those onerous requirements are not present. So schools have been very hopeful that their local Department of Health will take the lead on conducting testing activities. Unfortunately, we're seeing counties around the state, increasingly that's not possible. Counties are saying, we're willing to extend you our licensure designation as an LSL, but we are not able to actually conduct the testing for you. So in some cases, that means schools are either going to have to become licensed themselves to conduct their own testing through their school health staff, including school nurses, school physicians, et cetera. Or it may mean that they're having to collaborate with outside health agencies that likewise have LSL certification to be able to do the testing on their behalf. So we have consent issues along with this. People are often surprised to learn that there's no legal authority for schools to conduct any medical testing of students without parent consent. So consent is obviously not required when it's not the school themselves that is conducting the testing. If it's the county or an outside agency, then it's that agency or the county that's responsible for procuring consent. However, where it is the school themselves that is conducting the testing under our state public health law, the school is responsible for obtaining consent from any parent in order to conduct testing. We've also seen a lot of questions around staff. So non-schools have inquired, what will happen if staff are not cooperative in terms of obtaining COVID tests? Maybe staff want to stay home in schools. Maybe they are not interested in cooperating with conducting testing because they envision that as a way of being able to stay home. There's no doubt that those types of concerns will arise in orange and red zones. Our consensus as a school practice is that in the private sector, so in those schools that are private, non-unionized settings, there is no prohibition on the school mandating as a condition of employment that staff obtain testing as well, just as a condition of their employment. The public sector context is a lot more complicated just because surveillance testing has labor relations implications. However, our consensus there as a school practice likewise is that a school district does have the authority to mandate testing of staff if that testing is a government mandate, such as in the case of a red zone or an orange zone, where staff must be tested in order to return to work. How parent consent will be obtained is obviously a logistical nightmare as well that a lot of schools are navigating. If you're a parent of a child in a school, don't be surprised if your school is going to be taking the lead on the testing. Even if you are not yet designated as an orange or red zone, do expect that families may be reaching out to you proactively saying, will you consent in the event that we have to conduct testing? The reason for that is obvious. The administrative burden of having to secure those consents for, in some instances, thousands of students in our larger school systems is going to be very burdensome. And schools are trying to be proactive about obtaining that consent before the designation is upon them. Another common question that we get as well is, what is the implication if I reside in a red zone, but my child is attending school in, let's say, a zone that has not been designated, or a yellow zone, a zone of lesser severity and lesser spread? The school's designation is based on the zone. So depending on where the school is located, that is what drives whether your school will be open for business or not. It does not depend on the residence of the inhabitants of that school, but rather on the location of the school. So we actually have a situation here in Onondaga County which is likely to be the case in other school systems as well, where we have single school districts, because do recall, school districts in New York State do not track municipal boundaries exactly. They're separate government entities with separate government boundaries. So as a result, there are often situations, and as I said, I can think of one right now in our Syracuse region, where we have a district that part of their school buildings are within an orange zone, and part of their school buildings are not within any zone at all. So in that case, the best guidance we've been able to obtain from the Department of Health is we don't know, unless Katie's got something more up to date on that. But what we've been advising is it's a building by building analysis. If your building happens to be within a red zone or an orange zone, you're best to follow those precautions, which includes, as I said, the complete shutdown for 2 weeks, with the option of reopening after 5 days if robust testing is obtained. But in of course, the speed at which all of this guidance is drafted and the governor's executive orders are drafted, the devil's in the details on a lot of this. And we don't have great answers to a lot of that. We're hopeful that the Department of Health will continue to, provide us with some gloss so we can continue to provide robust advice on all these issues. Next slide. Oh, and we are at our question panel. So Katie, before we start taking questions, was there anything that you wanted to add to anything that I covered?
No, that was, I think a really good thing to emphasize here is there's just a lot we don't know. These things are written very quickly, which means there can be a lot of holes left in the guidance. We will, as always, continue to help find your ways out of that hole. We're not purposefully trying to find them for you. We're just here to help. So the size looks like my internet just cut out.
Nope, you're back, Katie.
Oh, I'm back. Great. All right, so let's start answering some of these questions. First thing, I think there's a good question for you to go to first. It's about, if 100% of the population does not consent to testing in an orange zone, does that mean the whole school population has to go remote? Like the way that schools in yellow zones must get consent from 20% of parents, or everyone had to go remote?
And I think if I understand the question correctly, the answer is yes. So essentially, let's just break it down. If you are in a yellow zone, you're required to be testing that percentage of your population in order to operate. If you cannot test that percentage of your in-person population because you can't, for instance, obtain parent consent, the answer is you're essentially like an orange or a red zone. You can't operate. You're fully remote. And that is something that schools have been leveraging as they are communicating with parents and caregivers to emphasize that consent is voluntary, but if we don't have consent, that's going to be potentially impairing our ability to offer in-person instruction. And of course, everybody wants in-person instruction for our kids, especially those of us that are, running businesses around the state. So in a orange or red zone, the answer is the same. If testing is not obtained of every individual, schools cannot reopen for the mandatory 2-week period that's treated as a complete closure. Now, under Department of Education guidelines and Department of Health guidelines, that doesn't mean that schools are relieved of their obligations to deliver instruction. What would happen in that case is they would pivot to their remote instruction model that was previously approved by the New York State Education Department back in August. Every school, public school, private school, charter school, had to submit detailed plans for how they would pivot to remote instruction in the event that they were required to go to remote. So that's essentially what would happen here. If the testing threshold cannot be satisfied, the school would have to roll out its remote instruction plans until such a time as they were cleared to commence in-person instruction. It does bear repeating, however, that although parent consent, again, is something that is a big wild card, staff consent should not be. If you are a school and you are having trouble obtaining voluntarily the required number of individuals to test to be able to reopen, I do encourage you to reach out to us because we do have some, labor relations theories to help you through that and through that roadblock.
All right. I'll take it a really easy question right now. Will hotels be considered an essential business? Yes, hotels are listed as an essential business. So in a red zone, they may remain open. How does that work with staffing? I'm not quite sure what that means, but you know, you can have anybody at the hotel that's essential and necessary for keeping the essential business operating. That is in your discretion as the employer to decide which employees would be necessary to provide your essential service. Let's go to another school question. If a school goes 100% remote in an orange or red zone, but still needs custodians to come in, how often do they need to be tested?
So that is an evolving issue as well. And that falls in the category of issues for which we do not have super clear guidance. What we had advised previously was that if any staff are coming in a red or an orange zone, they must be tested in order to come in. And now what we've heard anecdotally from clients that are located in at least 2 counties in the state is that they have received a Q&A from their county government. And, you know, we're still trying to source this and figure out if, you know, vet it and make sure it's coming from a bona fide location. But what at least 2 departments of health seem to be saying now is that although it is best practice to test those individuals, if they are not actually delivering instruction to children during the shutdown, they are not required to be tested in order to come in. Similar for food service. So if you are a food service provider as a public school district, you are likely providing meals per the governor's guidance when schools are closed. Previously, we would have said if your food service folks are coming in and you are in an orange zone or a red zone, they need to be tested. This most recent guidance that we seem to be trickling in through our field reps here is suggesting that is not the case, that DOH is going to be lenient with respect to those folks, that if they are coming in to do tasks and children are not in the building, then they do not need to be tested, although the recommendation is that testing is still best practice. Now, the guidance we've seen is that if there is a situation in which the school is seeking to reopen for children, in other words, they want to bring children back on the 5th day, as we discussed earlier, then those staff would go back into the pool for mandatory testing. They would have to be tested before they can come back in. But if children are not in the building, the current state of the guidance on that seems to be that they would not have to be included in your testing pool. But do continue to reach out to us so we can provide updates on that, as it does appear to be an evolving issue.
Great. Another question is, this is a good one. I think that's useful for local governments, at least. Are local government entities considered essential businesses? Technically, it's going to be a weird answer. State and local governments, that includes municipalities and their authorities, are exempt from essential business reductions, but they are still subject to other workforce reductions that exist. What currently exists right now, you have to continue following them, but municipalities and their authorities are not considered an essential business, but don't have to shut down. It's just they're fully separate from this. So that's a nice wrinkle of confusion. Another quick question I can answer. Wineries, breweries, distilleries, tasting rooms, if you are in an orange zone, you have to follow that no indoor service. It's the same liquor license that you're using. It's the on-premise liquor license. So it all fits in there. One other question I'll take care of while we're right here, and it's really quick for me to do it. Does an in-person work meeting or training that is appropriately socially distanced or masked considered a non-essential gathering and need to be kept to 10 people? Yes, it is still considered a non-essential gathering. It would still need to be kept to 10 people, and all of those social distancing and mask protocols still would need to be followed.
We have a couple of other school questions I'll tackle here too.
Perfect.
One of those questions is, if students are 100% remote, but some teachers choose to come in and work in the building, will they need to be tested as well? That the answer to that is the same as the answer that I gave to the last question, which is that previously we would have said yes, they need to be part of your testing pool. The most recent field guidance that we're getting from local departments of health around the state is that as long as children are not in the building, those individuals would not need to be included in your testing pool. If you wish to take advantage of bringing folks back on the 5th day, as opposed to waiting out the full closure period, then they would go back, those staff will go back into your testing pool and they would have to be tested before staff can come back in. There's a question regarding public school district libraries as well, and if public school district libraries are considered exempt or essential. Public school district libraries are considered separate municipal organizations under our state education law, as differentiated from free association libraries, which are different, but public school district libraries are considered government entities. As a result, they would fall under that same rule that Katie just mentioned. They're not considered essential businesses because the body that's responsible for defining what is an essential business does not have jurisdiction over public entities such as school districts and school district libraries, but they are exempt from those rules. So they're deemed to be essential for essentially different reasons than all the other businesses. They're not subject to the ESD guidance and guidelines, but they're nonetheless considered to be essential businesses and exempt.
How about this question for you? Since you answered the childcare question on the last webinar, I'll toss you this one. Are childcare entities limited to no more than 10 people in a group in an orange zone?
Oh, gee, you know, that is, so
that's fine. If we don't know it, that's all right.
We'll have to get back to you on that, to that question, because although I do dabble with the OCFS regulated entities, it's not my key zone of expertise. I try not to tread out of schools proper. So I don't have an answer to that one on the fly for you, but I'm happy to get back to you. We'll take down your name and get you a response.
I also don't have an answer for you on the fly on that one. So yes, we will get you that answer. Another, question just broadly, is it just the schools that have to do the 20% testing? Yes. Well, in yellow zones, at least. It's no other businesses or entities have to, in specifically in these zones, have to follow increased testing protocols. There are certain things that need to be done in nursing homes. We will not be going into detail about those today. Another, question is, how are these zones being determined? Is it an exact map by county? Are they using zip codes? No, they're really getting precise on the data. If you go to ny.gov or you go to New York Forward, you can get to the page that has all of these maps laid out. You can type in an address, it'll tell you exactly with your address what zone you're in. So a zip code may have, may actually have more than one zone. It may have part of a zip code may have no zone, another part may be a yellow zone, and another part of that same zip code may be an orange zone. So you really need to, if you are close to being impacted, either write that address in and see what it says.
School bus question too, that is a common question we're getting as we're veering towards more shutdowns. The question is, if schools choose to shut down in a yellow zone, are they required to honor their transportation contracts? Buses won't run, but transportation providers have existing contracts in place. This is a very complicated question for which we could probably provide an entire webinar just on dealing with your transportation obligations. I don't know that if the asker of this question is coming from a public school district or private school district. So I'll try to provide some guidance on both fronts. In either case, the answer to that question is going to be driven by your contracts. For those of you that are not school geeks on the phone, schools transport students via two mechanisms. They either have an in-house transportation department where they operate their own bus fleet, or they contract with outside providers such as First Student, as the biggest one here in New York State, to deliver their school transportation services. Whether you have an obligation to pay your transportation provider if you are contracting with transportation during a shutdown will depend entirely on the language in your contract with that transportation provider. If you have language in the contract that allows you to set routes In other words, that gives the school the authority to set routes and obligates you to pay on a per route basis, then you may have contractual grounds for saying you have no obligation to pay during any period of shutdown. In a public school district, the equation becomes more complicated. Same rule applies. The contract's going to drive whether there is discretion to pay or not pay during a shutdown. But the bigger implication there is that transportation aid for public school districts can only be awarded by the state education department for the actual transport of students. That's statutory. It's right in the New York State education law. Unfortunately, there's been no legislative relaxation of that rule and no executive order that relaxes it. So as a result, if you are a public school district and you are paying your transportation provider to do something other than transport children to school, you are at risk of having non-aidable transactions as part of that. So that is something to be very mindful of. As you're looking towards transportation contracts in the future, it's very important that those contingencies be outlined in your contracts going forward. But the majority of school transportation contracts I am aware of that I have analyzed through the shutdown period for both private and public schools have been pretty clear that it's the school that sets the route, and the routes are what are paid for, not a standing price to the contractor. So if you have similar language to that in your contract, you may have grounds for not paying during your period of shutdown, even if it's not a state mandated shutdown, even if it's a voluntary shutdown because you're in a yellow zone.
Yeah, that's a lot of information. Another good question. It says, what if you have a headquarters or an operation that's in a red zone, but it provides services to your other branches that are either in yellow zones or not in a zone? What do you do in that case? You still have to follow the non-essential business rule. If your business as a whole is considered a non-essential business, that business will need to close in the cluster zone, in the red zone. If it's providing an essential service to your branch offices, and you're going to determine that by, again, going to that Empire State Development list, seeing what functions on there you may be performing that are considered essential services that are necessary to support that non-essential business. Take a look at, accounting, those types of things, security. Take a look on there, but it's not going to be every single, it won't likely be every single department, especially if you're a non-essential business. So there's still lots of questions, but I think a good one for you too is if you have a staff member that lives in an orange zone but works in a different zone that isn't orange, so the school itself is in a non-cluster zone, can that person continue to come into school? What do we have to do with worrying about testing requirements, etc.?
Let's see if I understand this. So staff lives in an orange zone, works in a different zone that isn't orange. Can they come to work? And I believe the answer is yes, because once again, the restrictions on schools are driven by schools that are located within the orange zone. It's a weird gap, that we don't have an answer to why the rules are constructed that way, but it does appear that there are no restrictions on individuals based on where they live, but rather based on the location of the school which they're coming to work. So if you have somebody who is living in an orange zone, but you are located in a zone that hasn't been indicated with a COVID rating yet, there's no prohibition on that person coming to work, although there could be FFCRA implications because that worker may, if their child's school is closed, be requesting EFMLA to cover that, to cover their child's remote learning, and you potentially could be obligated to pay that at least through December 31st. We have a question about whether a business, whether a business that is a college has similar school testing requirements, and the answer is no. The executive order mandating school testing and the associated guidance applies to pre-K through 12 schools. It does not apply to higher education. So those requirements that we've been talking about today are strictly applicable to primary, secondary, PK through 12, not to higher education. Oh, looks like we lost Katie temporarily here.
I'm back.
Are you back? Lose you?
I don't know. Sometimes things come and go. One other question I really wanted to. Yeah. There was one other question I really wanted to get to before we're done, and all of these questions have been really good. One of them, it's specifically about indoor swimming pools closing with fitness centers. That's one. I read that very conservatively. I read it to say that if it's a swimming pool, it's likely considered as part of a fitness center. I would give either give us a call or have us, get in touch with your local economic development office, and that will, help decide, we can have a more thorough conversation about that. But one thing just to remember, if you're in a cluster zone, but your work is not in a cluster zone, you can continue to go to that office. What matters for the cluster, it's not where your people live, it's where your business is. And that's, I just made a catchphrase. And remember that mantra. That's going to be something that's important. So even if your business is never in one of these zones, you're just outside of one, and your employees all live in red zones, they can still come to work. At this point, there are no additional restrictions. I could potentially see more happening at some point, but I can't predict that. But if your office is in a yellow zone and your people live in a red zone, you follow the yellow zone guidance. Kate, were there other, questions that you wanted to answer? Or I know that there's so many still, but I don't know that if we could keep going all day.
I think I'm not seeing any additional school related questions. So I think we hit on all the school questions.
Great. And other, paid leave type questions, I would encourage you to get in touch with one of our labor and employment attorneys. There's certain things I can't get into because I don't know them, and I don't have any more room in my brain for to learn a whole other thing about paid leave. So I don't know them, but we can absolutely get you to the people that do know those answers. And finally, we've had a few questions coming up about Albany. Albany has yet to be designated as a cluster. The governor gave his warning track slide yesterday about places that were close to being designated. Albany was still not on that. So, we're biding our time out in Albany, and we'll go from there. But thank you so much to everybody that joined us today. And, we really appreciate you. Have a wonderful Thanksgiving. Stay safe.
Thanks,
enjoy.
everybody.
Yes. And we'll see you next week, I'm sure.